Good morning, Blaine. We are still here at Mahikeng Provincial Hospital, where earlier staff members were actually addressed by some different unions and the hospital management with regard to their meeting yesterday with the health authority. You can remember that some workers here at the maternity unit actually decided to down tools yesterday, saying they fear for their lives. Later on, the health authority held a meeting with the hospital management together with the respective unions to tell them or inform them that the 3 units which a doctor who is tested positive for COVID-19 at this very facility will be closed for decontamination. Those units are actually Ward 3, the maternity unit, together with the theatre. But to hear more about the feedback, I am now joined by one of the employees, Mr. Moshwete. Mr. Moshwete, you received feedback today from your different unions together with the hospital management. What is the latest with regard to that feedback, and are you happy with it?
Thank you. The CEO came and just addressed us earlier on, outlining what did MEC and the whole team clarified. The feedback is that the staff members who are the primary contact with the doctor will be tested, and the unit will be closed for decontamination, like they've said even yesterday on the media. But to us, we as the unit, the whole maternity unit, we are not happy about the approach and the manner of which this was dealt. Remember, this was reported on Monday, but they waited for us to do something in order to hear, for them to hear about this. Because even one of the doctors on Monday suggested that let this unit at least be closed for 48 hours so that measures can be done. But they waited 3 days so that they could take an action like that, because they started moving patients today around 8 o'clock to different facilities so that they can decontaminate the unit.
As you heard, Mr. Moshwete says that they are still not happy with the feedback that they actually received. But to hear more about the workers' grievances or concerns, I am now joined by the NEHAU secretary in the province, Mr. Makafani. Mr. Makafani, some of the members are still not happy with regard to the way this whole issue has been handled. What is your take with regard to that?
Well, our agreement is that management will then kickstart the processes of decontaminating the specific areas that are affected by the virus itself. And that will mean that they will have to follow the processes of decontamination to the latter, which includes, screening, testing in the workers, and those that are affected must actually be quarantined accordingly. And this therefore involves all workers who are in the affected areas. We were quite clear to management that absolutely nobody must be left out of the process, precisely because it affects their health. And in an event that the worker has contracted the virus, that worker is a danger to herself or himself and the people at the home and the society at large. So it's a quite serious matter. But this, how it has manifested, has actually exposed the complacency and the dragging of foot of the management. We hope that everybody shall have learned on this process that if you do have a contingency plan on paper, but you can't put it in practice expeditiously or promptly, this will be the result. It was really unnecessary for them to wait for the workers to explode and take to an industrial action instead of just implementing what you call the contingency plan and accepting that indeed there's a problem.
We understand that only for now, actually, there will be others who will be tested and others will be tested later. What is your view with regard to that?
Well, we suspect that in terms of the capacity, really, from the employer side, they are not having enough capacity. For all the stakeholders that are involved in the process of testing and screening, there's a challenge of capacity. It's a matter that by now we thought that it should have been addressed and attended to. that nobody must be frustrated in the process because the internal capacity is not sufficient to handle the situation. And it's a matter that ourselves as a trade union will be monitoring and ensure that, as we say, absolutely nobody is sidelined or is not taken into consideration in terms of ensuring that they are healthy in the process. Hence, we welcome as the union, as per the communication yesterday by the department itself, that they are attempting to get a military backup in terms of the staff members of the affected areas, that the military backup must come in, those workers must be attended to. And we are quite sure that will not rest until every worker has satisfied themselves that they are clear, they have been cleared of the virus, that including the hospital, the areas affected are safe for workers to come back and work in as well. Also monitoring cautiously the processes of distance, observing availability of the PPEs and so forth.
As the union, when do you feel like, or do you think will be the perfect time to complete all these processes that have started already?
Look, we are a bit worried about what seems to be an unclear turnaround strategy from the management. We think that we will remain on standby through our structures. We have shop stewards here who should be monitoring the processes. And where really we think that there's a stalling of the process, we shall put the necessary pressure, because we do not agree that the replacement labor should remain in Bophelong Hospital forever. We think that workers that has been employed, they've got the love of this job, they want to do the job, but they must attend to the safety measures. And prolonging those processes may have undesired consequences, which will affect the society at large, because public servants are society members and they interact with the whole community wherever they are living. So it will be dangerous then to prolong the process, and we think that that process, all of us trade unions involved and the management must take it seriously and ensure that we prioritize that particular aspect. The sooner the better. We shouldn't really say by the end of this month we still have a pending process just on the screening and testing. It will be really unfair. It will be dangerous to allow that situation.
There was the NEHAU secretary in the province, Mr. Makafane, saying they will make sure that proper procedures are actually followed and all the tests are conducted and everything necessary to be done is completed on time. That is it from me for now. It's back to you in the studio.